has been involved with a number of European organizations, and you heard a little bit about that earlier today. And just to keep things rolling here, right after Pierre finishes, Deborah, who you've also met earlier, works with CLL Patient Advocacy Group out of Canada, and has been very involved in putting on incredible educational forums near Niagara Falls. If you ever get a chance to go, try to get to them. They're wonderful. But has also been involved in helping the CLL community getting access to drugs, dealing with issues there, working with the different provincial governments in the regulatory, and she's going to talk about an experience she had there too. So that way we can speed things up here a little.
Okay, let's be as short as possible. Well, I will try and tell you what we are expecting in France about patient's voice. Why is it important? Of course, patients want to feel listened to and better supported. Not every clinician, as you may know, is voice patient oriented. We have a good example here, but it's not the reality for all of them. Pharma industry must also develop the right treatment. Healthcare provider must improve their organization. It's particularly the case in France because you know the hospital organization is questioned. And last but not least, health authorities must know what the challenges are and consequently adapt the rules. So, for instance, the delay we have in France in order to get authorization and reimbursement is very high, and it's of course a great concern for us. One of the tools we use to develop in France is the surveys. What could be those surveys? We try to focus on the patient's real life, because if the patient's voice doesn't bring the real life of the patient, it's for nothing. All stages of the patient pathway should be covered, because the situation is changing a lot. Just think about the ambulatory treatment. It's something quite different than the other one. All patient interaction with the various stakeholders should be addressed if possible, because the relationship of the patient is not only with the clinician, it is with the nurses, it is with how do you say that, pharmacy, hypothec? No, never mind. Well, and of course, sometimes some special focus has to be made for some relevant situation or issues, and we have an example of this kind afterwards. How can it be used? That's the example we have in France. What we use, the result of the surveys. Well, general presentation during congresses and seminars targeting all stakeholders. It was the case, for instance, in the French Hematology Congress, of course, but it may be the case also in a Horizon meeting. I had the pleasure to present the 2015 survey here, not here, but in Belgrade, 3 years ago. Sharing results through medias and social networks. That is something we had an example in the UK. Having some information communicated to newspaper may be helpful. Answering question of health authorities, that is absolutely key, and it's something relatively new in France. We have to answer a question of the health authority in order to for a treatment to be authorized or not, and then I come back to that afterwards. Making industry aware of the patient needs and of the effects of the treatment. It's not always that simple to appreciate the side effects when you are member of the industry, the pharmaceutical industry, but it is absolutely key in terms of authorization and at the end of the day for the patient. It increases when you can rely on evidence, as Zach mentioned, out of surveys which are supposed to tell the real voice of the patient. You are increasing the credibility of your messages, and that's of course extremely important. And you can, out of the results of the survey, launch initiatives. I see that Zach mentioned some new services. We have the same in France. What did you do? We regularly launch patients' real-life surveys. 2015, I already mentioned that. I had the pleasure to present the result in Belgrade. In 2018, we addressed the questionnaire at 2,000, let's say, CLL patients. We have in our database, mainly those are our members, so to say, and we got almost 1,000 answers, which is of course a ratio which is pretty good. And in 2019, we decided to launch a special survey in order to try and answer with more credibility a question of the health authority. By the way, one of the results of the survey 2018 is quite interesting. Unfortunately, it's in French, but I couldn't, I didn't succeed in translating those parts. The blue line is topics that are quite important for the patients, and the red line is topics that are less important for the patient. And if you see, access to medical information is quite important. That's the role of the patient advocate. Deliver medical information. I can ask the question to the advocates. The advocate is supposed to lobby politics and health decision makers. That's absolutely important. What the topic today is about. Practical information. Okay, that's not that perhaps not that important. Exchanges with other patients. That's something like the forum we have in SILLC. Support the research, of course, and it's interesting. Social information are important as well. Psychological support seems to be less important to the patient, surprisingly enough, I should say, but it may well be because we are not really addressing so far this issue, because I do not see why the psychologist support wouldn't be important for the patient. But that was the result of the survey. So, how did SILLC use the result of those surveys we made? Detailed presentation during the French Hematology Congress, targeting clinicians and industry. Well, it has been followed by a lot of clinicians. I think they have been aware through this result of the situation of the patient. Publication in health specialized newspaper. We try to address, of course, the clinicians. Publication in newspaper with larger audience. That's a little bit like the Times in the UK, but we didn't get the call of a lord because there are no lords in France, so I'm very, very sorry. And very important answer to the French health authorities about a new CL multitherapy. So both a monotherapy, it was venetoclax to be clear enough, and the second one was the Murano combination. And you get the question of the health authority. You have about 1 month to answer. It's extremely quick, and we had the problem, what do we do? We had an experience that we answered as experts, but it was, of course, not credible evidence enough, apart from some suggestions we made or remarks we made that may be dangerous. For instance, we say, well, the efficiency seems to be good, but there are side effects or some other questions. And we had the bad experience one time to see that the health authority said, well, the patients say there are some relevant questions not answered so far, then we delay the authorization, or we refuse the authorization. So you have to be extremely cautious what we are saying. If you are representing the voice of the patient, it could be used in a positive way, it could well be used in a negative way, and it's extremely dangerous. So we decided to launch a survey, and then we have, of course, the problem that Zach mentioned of the statistical credibility of such a survey, because if you are addressing people that have been treated by venetoclax or that have been treated by venetoclax plus rituximab or whatever, you have, of course, a number of answering people which is extremely small. So we nevertheless tried. And we used these answers, mentioning that it was, of course, a very reduced.
Speed up a little bit. Yeah.
Okay. So, I mean, I am fast at the end. The last point is quite important as well. It's not the result of the focused survey. It's a result of the larger one, and we developed with some private operators, a platform, a telephone platform addressed to the patients who are under ambulatory treatment, in order for them to be informed, of course, in link with the physician or the nurses, and on the phone you have specialized nurses who are aware of the disease. So, I mean, it's important also for the compliance, for the treatment compliance, for instance. No? So that's it, and that was, of course, something we felt absolutely necessary from our last wide survey. That's it.